Hey, welcome. Dr. Isabella Wentz here. Day 2 of the Thyroid Secret is here. And I'm going to be taking your questions live. And we're also going to be talking about some of the biggest takeaways from day 2. If you're just joining me, I apologize. I showed up fashionably late. I actually had a power outage here, and we had to restart my entire computer and the whole system. So if you are here, if you could let me know, if you can put a like or a heart or write in the comments where you're from and your name, and that way I'll be able to see that my sound is working and that everything is going fine, because for a minute there I wasn't sure if I was going to be able to get on tonight. Interestingly, the last time I actually did a webinar with Dr. Kelly Brogan, who's featured in episode 2 of the Thyroid Secret, and we talked about the connection between depression and the thyroid gland, and I had a power outage then as well. So I don't know if this is the universe trying to tell me or something, I don't know, but I'm not going to stop. I'm going to keep spreading this message. And actually, if you guys are here, so Rose, hello, I see you. Thank you for the beautiful flower and the butterfly. Hello to you. Anybody else? Are you guys hearing me, seeing me? Let me know. I know that I'm dialing in a little bit late because I had a power outage at the house here. So if you are struggling with brain fog, depression, or anxiety, I want you to know that these are thyroid symptoms. And this is really, really, really important, because in a lot of times this mood, brain, whatever you want to call it, issue can be temporary. Not a lot of people are aware of this, and they get misdiagnosed with mental health issues, and they go on their entire lives. I see Dale here. Thank you so much, Dale. Dale says, you inspire me so much. I really appreciate that. Tina from Texas says hello. Let's see, I have Anna from Fort Lauderdale. Hello, Anna. How are you doing? Kelly Marie, thank you for the beautiful heart. I see you guys are dialing in and you're seeing me online. That's fantastic. And if you are just joining, we're talking about the Thyroid Secret. So the Thyroid Secret is a documentary series that I created over the last year, and I wanted to really dispel the myths behind thyroid disease. One of these myths is very much related to the brain. So thyroid disease can actually affect our brain, but not many people know this, and not many doctors know this. And people end up feeling lazy, crazy, or a combination of both. Let's see here, we have other people are joining in. So Lillian, hello, how are you doing? We have Bobby from Miami, how are you? Haley from California. Jessica says, your book Root Cause changed my life and my Hashi's walk. Oh, thank you so much, I really appreciate that. Wanda says thank you and is giving me hearts. Lori, how are you doing? So Lori's dialing in again from Long Beach. Nice to see you on here again. Stephanie, Judy, hello Judy from Tampa. Jennifer from Kansas, hello. James from Australia, wow, I think you're the furthest online friend tonight. Wow, Regina from Brazil, Sao Paulo, hello Regina, nice to see you on here. Deborah from Minnesota, Joanna, hello Joanna. Trish, how are you doing, Trish? Trish is experiencing anxiety, and we're going to talk about that today. Rhonda from Corpus Christi, wonderful. Ania, Niemiec, cześć Ania z Kanady. Maria from Worcester. Joanne is saying it's a very enlightening series. Hello, Barbara from New York. Elisha from Australia. And then we have another person from Sydney. Hello, Zubida. Dale from Ontario, Canada. Fu from San Antonio, Texas. Kelly from Australia. Wow, we've got such a great crowd here. So we're looking at an international crowd, and I'm really excited to have all of you guys here with me tonight. I'm Dr. Isabella Wentz. I am a clinical pharmacist. I'm the creator of the Thyroid Secret documentary series, and also the author of the New York Times bestselling guide, Hashimoto's The Root Cause, which you can see behind me, as well as Hashimoto's Protocol, which is coming out in, oh my goodness, less than 4 weeks. Holy cow. And so tonight I wanted to talk about thyroid disease and how it can affect the brain with you guys, and go through some of the top takeaways from the Thyroid Secret. So let me know, you guys, how many of you are watching the Thyroid Secret right now? Have you been able to watch episode 2 this time around, or did you watch it maybe last time around when I released it exclusively to my thyroid community. I'd love to know who's watching the Thyroid Secret. So if you could leave me a comment. If you have not registered to watch, we have a link here in the description of this Facebook Live event. It's a tinyurl.com link that will take you to the Thyroid Secret event, and that way you can register for that and then get this today's episode to watch for free, as well as all the other episodes. So Melanie just finished episode 1. Angela is watching, and so is Iris and Maria. Tanya is just watched episode 1, and Chris has just watched episode 1. Dale hasn't watched yet. She's watching for the first time and mind blown. So I'm so excited to hear that. Let's see. Melissa said she didn't get the email for 2, but found it on the schedule. So I'm really glad to hear that. And Rita just watched Thyroid Secret last night and is viewing the second one. Elisha also hasn't seen number 2. So we actually just released episode 2 about 2 hours ago. So let's see, Jerry has already watched episode 1 and 2. So that's wonderful, Jerry. I'm really happy that you've been able to watch that. And Gina watched episode 1 last night and episode 2 tonight. Christina got a chance to watch episode 1, and Muhammad is watching for the first time. So awesome. Thanks you guys so much for the feedback. So episode 2, we're really focusing in on the brain and how the brain can affect thyroid conditions, or how thyroid conditions can affect the brain. And so what I mean by that, the most common symptoms of thyroid disease are going to be fatigue, they're going to be weight gain, and then depression, brain fog, fatigue are going to be some of the additional more common symptoms. So if we were to break down the top 3 symptoms of thyroid disease, we're going to be looking at fatigue, weight gain, and then brain or mood symptoms. This is a really, really important topic, and one thing that I just really want to mention out there is oftentimes thyroid disease is misdiagnosed for depression, anxiety, panic disorders, bipolar disorder. I've even seen people who were hospitalized for psychotic disorders. Now, this to me is just quite devastating. I have some personal experience with mental health issues that I'll share a little bit later with you guys, but I just think this is a crime, because there are so many people that their quote-unquote mental health issue is actually caused by the thyroid gland and the immune system being out of balance. And once we get the immune system and the thyroid gland into balance, we no longer have mental health issues, so we can lose a diagnosis. If you're watching this, I really would ask you to do me a huge favor, and really do all of your friends a huge favor, and share this on your timeline and let them know that mood disorders are temporary. So if you have forgetfulness, if you have depression, anxiety, panic attacks, all of these things could be caused by your thyroid and immune system imbalance, and all of them can be resolved. My personal story is that I was actually, when I first started having thyroid symptoms, I was misdiagnosed with depression, and I was sleeping all of the time. I couldn't make decisions. I couldn't remember anything. And I was no longer my bubbly self. I was no longer excited about life. And thyroid disease was the root cause of that. Now, a lot of times people will be sent to counselors. That's the route that my parents took with me. They're very caring people, and they said, you need to go to counseling because something's wrong. But, counseling is not going to, of course it always helps, don't get me wrong, but if you have a biochemical imbalance in your body, the counseling is not going to address that. So we need to really look at what's the root cause of that. A few years down after that point, I was also misdiagnosed with panic attacks and anxiety disorders. My husband would go out running, and I would say, okay, honey, when are you going to be back? And he would say, I will be back in an hour. And an hour and 5 minutes would pass by, and I would be devastated. I'd be on the bathroom floor crying, freaking out, worried that he got hit by a car, or he passed out with a heart attack, or, worse off, ran off with another woman, because I just wasn't able to control myself anymore and wasn't able to control my emotions. And this is very, very common in people with thyroid disease. Trudy Scott was an expert that was featured in episode 2, and she's a good friend of mine. She's the food mood queen. And she says that anywhere, at least 50% of people who come to her with anxiety actually have thyroid disease. And so that's a really, really big takeaway. And I know many people are medicated and they're put on antidepressants when in fact they have a thyroid condition. You guys might see I probably have a little bit of bags under my eyes. I couldn't sleep last night. I was watching all of your comments coming in. Last night was the very first time that the Thyroid Secret episode 1 came out, and episode 1 was focused on all of the symptoms that are associated with thyroid disease. And I just saw some of your comments, and I just saw many of you had been suffering for years. And the Thyroid Secret was the first time you actually received validation, and the very first time that some of you realized that you're not crazy, that you feel depressed and anxious because it's related to your thyroid. And I'm just so sorry for all of you that have been suffering for so long. I know what it's like to suffer. I personally suffered from anxiety and depression that was induced by my thyroid disease and autoimmunity. And I want to assure you, if you're feeling like there's no hope, if you're feeling like it's hopeless, there is hope. You can recover your health. You can get rid of all of your symptoms. So the depression, brain fog, anxiety, those are just temporary. And, you know, honestly, I've seen people who were placed on heavy-duty psychotropic, antipsychotic medications, the dirtiest drugs out there. And as a pharmacist, this is very near and dear to my heart. I used to actually work as a consulting pharmacist where my primary job was to monitor people for side effects. And oftentimes, I would make sure to try to reduce or take people off of those drugs because they're so heavy-duty and they have such severe side effects. Well, I've seen people who, once they found out they actually had thyroid disease, not psychotic disorders, not bipolar disorder, not anxiety disorders, they were able to come off of their antidepressants and psychotropic meds completely, and they lost that mental health diagnosis. And I know there's a stigma for people who have are told that they have mental health issues, and they of course don't feel good in the first place, but also what all of society tells us. And certainly when I was working as a pharmacist, I used to think that these things were long-term, and that if you had bipolar disorder, this was something you would have your whole life. But I've learned this is not the case. You actually can reverse all of these conditions, anxiety, bipolar disorder, panic attacks, when you get proper thyroid care. Now, I see a lot of you guys are asking some questions, so I'm going to get to your questions, but before that, if you can do me a huge favor and share this on your timeline and let people know that thyroid conditions can actually cause mental health issues and that they do not need to suffer with mental health issues, that these things are temporary, can be completely reversed with proper care. Let's see here. I've got a lot of really great questions here. I'm going to try to answer as many as I can. We're going to be here for a little bit. Patty says, my short-term memory is very bad. This is very much a common sign of thyroid disease, not properly treated thyroid disease. Some people call it brain fog. I know for me this was a huge symptom, and I've always been very sharp and bright-eyed and bushy-tailed, but yet the brain fog really prevented me from showing up in the world the way I wanted to. I was no longer as sharp as I used to be. I used to go to work meetings, and I had to write everything down. Otherwise, I would have forgotten everything that was there. Debbie shared, I've been on antidepressants for over 20 years, been hospitalized 3 times, never knew it could have been associated with thyroid. I'm so sorry to hear that, Debbie. It's, I really think it's a tragedy, and that's why I'm encouraging all of you guys, please, please, please share this on your timeline. You might just save somebody's life. You may prevent a suicide potentially, because we know people in the winter, especially, this is a higher risk for that. And a lot of people who have depression, seasonal affective disorder, seasonal depression, postpartum depression, this might be actually due to the thyroid gland. And so please share this on your timeline. The first time I learned about thyroid disease being connected to mental health issues, I was working as a consultant, and we had this woman who was just so depressed and psychotic and very overweight, very forgetful. There was talk about her having some intellectual disability, but when I looked at her chart, I noticed that she was once thriving, and she had a husband and a son and a job, and she was happy-go-lucky. And one of the things I did is, in my job as a consultant, I had to review like every single medical record for a person's entire life, and this sometimes would take me, a couple of days of investigative work. And I actually found that this woman had thyroid disease, and she was taken off of her thyroid meds. And so this can actually happen if you don't have proper thyroid care. You can become depressed, lethargic. And unfortunately, the very first thing that doctors think about is depression. Let's put you on antidepressants. I know this was my case when I went and told my doctor that I was very tired and that I was anxious. And they said, you need antidepressants. And I was like, wait a minute, there's got to be more to this, right? And I hope all of you guys are asking that question. And I really think you are, because you're here and you're talking about this. If you haven't registered for the Thyroid Secret, we're in day 2. We're really covering the mental health issues, quote unquote, related to thyroid disease and how we can reverse them. So there. So there's a link in the description here that, sorry guys, we got paused. So if you are watching this broadcast right now, and if you're struggling with brain fog, depression, anxiety, panic attacks, anything like that, please go to the description here. We have a link for you where you can register to watch the Thyroid Secret for free. You may just lose a mental health diagnosis. Let's see, I've got wonderful questions here. Can you have a thyroid problem if your labs come back within normal range? Elizabeth, you can. So most doctors only test one test. It's the TSH test, and that's going to be normal for up to 10 years of when you actually have a thyroid problem. The test that you need to ask for is going to be the thyroid antibody tests panel. And so you're looking at TSH receptor antibodies, TSI antibodies, TPO antibodies, and TG antibodies. So if you have a pen, it's TSH antibodies, TSI antibodies, TPO antibodies, and TG antibodies. Now these antibodies are going to tell us if the immune system is launching an attack on the thyroid gland. And this attack on the thyroid gland has actually been associated with, you guessed it, anxiety, depression, weight gain, fatigue, even when all the other thyroid tests are normal. Even one person, there was a case study of a woman who was told that she had borderline personality disorder, and nurses monitored her at the hospital where she was hospitalized, and on the day that she had really high thyroid antibodies, she had more symptoms of borderline personality disorder. On the day that she had low thyroid antibodies, it was like she didn't have many symptoms of the personality disorder. So this is something that's very, very relevant. And thyroid conditions, both underactive and overactive thyroid, can cause many, many symptoms that are related to the brain. So let's see, I've got a lot of great questions here. Chris says, I'm learning so much. I'm so happy to hear that. Stephanie says, my memory has just gone downhill. My phone was in my notebook. I've lost everything. It's so frustrating. I'm so sorry to hear that, Stephanie. I do want to let you know that you can turn it around, and it's temporary, and you're not going crazy. You're going to get your brain back. We cover this in episode 2. Important question here. Angela wanted to know about vertigo. Can you suffer from vertigo? This is a very, very common co-occurring condition with Hashimoto's. And let me tell you something. When you have thyroid antibodies against your thyroid gland, these antibodies may cross with various things. One of the places where they can cross-react is with your inner ear proteins, and this can actually lead to vertigo. So one of the things I found is when you address and reduce your thyroid antibodies, which we're going to really dive deep into the strategies in tomorrow's episode, episode 3, you can actually get rid of vertigo, and I've seen it time and time again. people who have had vertigo for a really, really long time. This can actually be temporary as well. Karen said she was put on antidepressants. You know, I really think a lot of us were. So thyroid conditions, the primary treatment for an underactive thyroid is a medication known as T4, synthetic thyroid hormone. The most common brand name is Synthroid. Now, this medication works well for some people, but there's a certain percentage of us, and I would say endocrinologists will say 5%, researchers will say 10 to 20%, I would say 80% as the thyroid pharmacist, that we just don't convert that T4 to T3 correctly. And one of the very, very amazing things that can happen is when a person takes T3 in the form of thyroid hormone, their depression can completely lift. So we had a wonderful woman share her story in episode 2 of what happened when she switched over from levothyroxine, which contains T4, to a medication that contained T3 as well. And you can get this through natural desiccated thyroid, compounded thyroid medications, or having your doctor add in a medication like Cytomel to your mix. And this is something that's going to be very inexpensive, less than $20 a month, even if you're paying out of pocket, and very much something that you should do. One kind of hint for you guys is people will often say, well, my doctor doesn't want to prescribe this medication, they won't do it. Find a doctor that will. Get in touch with your local compounding pharmacy and ask them for a list of doctors that know how to use all kinds of thyroid medications, not just T4 medications, but do they know how to use compounded thyroid medications? Do they know how to use medications like natural desiccated thyroid? Because those are the doctors that are going to be able to help you and not give you a cookie cutter approach for your thyroid, but actually give you something, you know, tailor the medication to your needs. Tracy says, hi, Isabella. Elisha says, what's the range of antibodies? I was told my levels are low, so I don't have Hashis, but I have all the symptoms. So here's the interesting thing, Elisha. The antibodies, conventional medicine will say above 35 is considered positive for Hashimoto's, for the thyroid antibodies. Now, if you're a person without thyroid disease, you should have a thyroid antibody of either 0 or 1. And so if you're at like 10, 12, 15, 20, that's an indication that your immune system is attacking your thyroid gland. And here's the other kind of tricky part where we kind of throw a wrench into the whole thing. There's also something known as seronegative Hashimoto's, where a person doesn't have thyroid antibodies at all, ever. And so, but they still have thyroid disease. They still have the immune system attacking their thyroid, and they still have damage to their thyroid gland. Now, this can be discovered on a thyroid ultrasound. So if you haven't had that test, I'd encourage you to get that as well. Next, let's see here. Does your book cover everything you're talking about in the series? Yeah, my book is focused specifically on Hashimoto's. So it does cover everything related to Hashimoto's. The series does cover thyroid nodules, covers Graves' disease, thyroid cancer, as well as postpartum thyroid issues, and so as well as Hashimoto's. So the Thyroid Secret series covers every single kind of thyroid condition out there. And if you haven't registered yet, the description on how to register for the Thyroid Secret is in this link here. We're currently airing episode 2, where we talk about some of the brain-related symptoms, like brain fog, depression, anxiety, vertigo, that are going to be related. Another kind of key takeaway from episode 2 is that some people, when they have thyroid antibodies, they can actually have brain antibodies. And this is when we might see some balance issues and ataxia and those kinds of things, neurological problems. There's something known as Hashimoto's encephalopathy, and this can be brought on by Hashimoto's antibodies crossing the blood-brain barrier and attacking our brain. And this is something that's very scary. Very extreme cases are going to be rare, but some people might have this low-grade inflammation, and one of the ways to test is if you're having trouble with balance. We do cover that in episode 2 in great detail. I had the privilege and the honor of spending a day in the office of Dr. Datis Karazian, who's a wonderful innovator in thyroid disorders and autoimmunity, and especially in brain disorders. So he specializes in brain-induced autoimmunity, and this is something that you can reverse and you can address. So I do hope that you check into episode 2 if this is something that you're dealing with. Raji wants to know, why do doctors not prescribe T3 medications? Raji, the reason for that is a lot of times, it's actually a complicated question. We do cover it in great detail in episode 3. Carter Black, who's a pharmacist on my team, and I've been collaborating with him for the last 4 years, and he's helped me actually with my own thyroid and adrenal issues before we started collaborating. He is somebody that has been a pharmacist for a very long time, and he's told me about the history of various thyroid hormones. And what's interesting is that T4 has become the preferred drug of choice, partially because of marketing and partially because weight loss clinics were improperly using T3 to try to induce weight loss in people without thyroid disease, and they also happen to give them diuretics as well as amphetamines. Now, I don't think you have to be a pharmacist to realize that when you give somebody amphetamines, diuretics, and thyroid hormone to a person without thyroid disease that's overweight, and you're telling them to exercise, that you're going to be in trouble. And this is what happened, is a lot of people were hospitalized. They had cardiac issues. It was a touch and go situation with them. And so this was something that has sort of gotten those medications out of favor. Now, here's the deal. Thyroid hormones are Goldilocks nutrients, and you need to have just the right dose and the right kind to be effective. This is why I always encourage you to work with a doctor that knows how to prescribe these medications. You don't want to go to your doctor that only knows T4 medications and say, can you give me T3? That can get you in trouble. One, the doctor is not going to appreciate it as sure many of you have gone through. But 2, do you really want to be the doctor's very first patient on a medication that they've never used? I don't think so. You want to find somebody that knows what they're doing with medications. So trust me, I'm a pharmacist. I know this stuff. Next question. Sherry wants to know, I'm hypothyroid. Is that Hashimoto's? Sherry, 95% of people who have hypothyroidism actually have Hashimoto's. And Hashimoto's has 5 stages. In the first stage, we just have the genetic predisposition. In the second stage, we start having antibodies and those symptoms like anxiety, depression, brain fog, so on and so forth. And then in stage 3, we start becoming subclinically hypothyroid, where we're just slightly hypothyroid. And in stage 4 is when we start being hypothyroid. That's when most people get diagnosed. The scary part of this is stage 5 is actually when we progress to other types of autoimmune conditions. And so for any of you guys, if you could share this on your timeline, please. Anybody that's going through brain fog, depression, anxiety, bipolar disorder, ataxia, vertigo, dizziness, these are all potential signs and symptoms that the person may have thyroid disease, and then it's still in the early stages and they're not getting the proper care and diagnosis that they need. So if you share this information on your timeline, you may prevent a lifetime of suffering for them. I know I suffered for almost a decade before I got my diagnosis, and sadly that seems to be the average. One of my goals with the Thyroid Secret is to shorten that average. Question here, how similar are Graves' and Hashimoto's? What is the difference? So Rita, that's a really great question. They're both autoimmune conditions that impact the thyroid gland, and they both have very common root causes, oftentimes the same root causes. The difference is it's a different type of antibody affecting the thyroid gland. So in Hashimoto's, what happens is we end up with damage to the thyroid gland, and we no longer have the ability to produce thyroid hormone because our thyroid gland is so damaged. Now, with Graves' disease, the antibodies basically may mess up the regulating mechanism that tells us to stop making thyroid hormones. So it's almost like a crazy person hijacked your car and just started driving it really, really fast. And that's what happens with Graves' disease, where you have an overabundance of thyroid hormone. And this can lead to anxiety, palpitations, panic attacks, irritability, overall feeling, really short-tempered with people. I once was over-medicated during my thyroid journey and had hyperthyroidism. I was driving with my mom in my car, and you know, I have people tell me like I have like the patience of a saint, and I'm just always really relaxed and really chill. But when I was over medicated, I yelled at my own mother. I think she was giving me directions. We were going shopping, and I missed the turn, and she was like, "Oh, you know, turn here," and it wasn't a big deal. And I lost it. I just started yelling at her. Of course, I felt horrible, which anybody does when they're going through thyroid issues, but it wasn't something I was able to control. It's like the thyroid hormones, when they're out of balance, our emotions are no longer ours. They're going to be all over the place. Biggest difference with treatment of Graves' disease and Hashimoto's is you still want to do all the root cause things, but in Hashimoto's, you want to give more thyroid hormone. In Graves' disease, you want to try to suppress thyroid hormone production. And we get into a lot of these treatments actually in episode 3, where we really start pulling back the curtain and jumping into some of these advanced, innovative strategies that can really give you your life back. And I mean it. I've seen it time and time again. The experts in this series have seen it time and time again, and the patients in this series have gotten their life back too, and this can be you. Question here. Rhonda said, it won't let me watch the video. Rhonda, if you actually want to go email info@thethyroidsecret.com. My team can help you out. So anybody that's having trouble, please email info@thethyroidsecret.com. They're going to help you guys out. Let me just actually chat that. Thyroidsecret.com. Hopefully I spell it correctly here. That's